The New Mexico Nursing Excellence Award celebrates the nurses of our state by recognizing excellence in practice and leadership. Nurses at the University of New Mexico Hospital have swept the awards, and this year's winner, Connie Hardy Tabet, joins us this morning. Good morning. Congratulations.
Good morning. Thank you.
And I should also mention that these awards were actually given out in October, and Tu Casa Fox and our sister station KRQE are proud sponsors, so really happy that you won this award this year.
It was a surprise.
It was. Well, first of all, tell us a little bit about what you do. Your category, your winning category is perioperative. Let me get that right. Can you explain what that is?
You know what? It's working in the pre-anesthesia, the pre-op when you come in to have surgery and you get all set up and you have your IV placed and they ask you a bunch of questions, and then it follows all the way through to the recovery room, to peri-anesthesia nursing.
Okay, so it's all the stuff that happens before operation.
Before and after. It's the whole process.
The whole process. Okay, and you're one of 400 nurses in the country that are certified in peri-anesthesia. Can you tell me more about that and kind of what drew you to do this?
Well, for peri-anesthesia nursing, there's two categories that you can be certified in. One is CPAN and one is CAPA, and there are two individual ones, and this field happens to have two. One's more focused on ambulatory surgery, and the other one is more focused on inpatient or phase 2 category of, or phase 1 category of peri-anesthesia nursing in the recovery room.
A lot of technical talk. I know it takes a lot of brains, I'm sure, to do what you are doing. I can only imagine. And you know, and I bet it takes a lot of, too, since you're doing all this stuff, pre-operative, post-operative, I bet it takes a really good skill in keeping people calm. I mean, do you ever come across, I'm sure all the time, patients that are really jittery or nervous? I mean, how do you deal with that?
The majority of people are very nervous. Their blood pressure's up, they're anxious. Most nurses want to put everybody at ease at the bedside and let them know, even though this is normal for us, this is not normal for somebody that comes in, or their family member. So our goal is to put them at ease, make them comfortable, and transition as much, and get through the process as possible.
Okay, now what do you think is your favorite part or the best part of your job? What do you like the most?
Watching people wake up immediately. You know, I mean, they're drowsy, but within 2 hours, they're ready to go back. In the field that I'm in at the time, it's outpatient. So within 2 hours, even an hour, they are ready to go home. They're sleepy, and then they're sedated, and they're ready to go function. Now, they're not high functioning at home.
Right.
They're sedated, and we encourage them not to drive and do some common sense stuff. But that's our goal, is to keep them safe, make sure their airways open, and there's so many things that can go wrong, but there's so many things that are just go beautiful.
That's what I was just about to say with anesthesia. You know, that's always a really scary thing when you get put under, and that's what you're dealing with. I mean, does it take a lot of courage and guts to deal with that?
The anesthesiologists are a great part of our team, and they're one of the leaders, and they really help facilitate a smooth transition for the patient so they have the safest care given.
And you're so calm about the matter. I'm sure it's very reassuring for the patients to hear from you and have you there before and after the surgery, and kind of helping them get through that process. So, now tell us a little bit more about a career in nursing. Can you tell us about some of the classes that you took to be educated in this and kind of that process?
Well, there's so many different, I mean, there's a school, but there's so many different avenues that you can take when after you graduate from school in nursing. Some people say they're afraid of needles, but you can work in places where you don't even see a needle. There's so many, there's case management, there's teaching, there's you can do online teaching also. There's the bedside nursing, there's the med-surg, there's so many different avenues, and I'm thankful that I was able to do so many. So critical care was one. I did a travel nurse. I came from Canada and did that. So as for the, there's 2-year programs, there's 4-year programs. You can do a lot of schooling online. There's so many different venues that you can do nursing.
Right, yeah, and like you said, you were in Canada getting some of your schooling there, so I'm sure it's a little bit of a different process, but you're all learning the same things.
Yes.
So do you have any advice that you can give anyone who's looking to get into this field?
You know, it has so many options that allows for family. It allows time, day, night, if you want to work different shifts. There's Monday through Friday, there's weekends, there's so many opportunities that you can be in nursing.
Right, so you can do it if you have a family. You feel like it's a good job, even if you do have a family, there's time. That's great, because a lot of times, you know, you work those odd hours, but I guess there's always a way to kind of work through that.
A lot of nurses do that. A lot of nurses are moms, so we make it work.
We make it work. Oh, that's great. Now, we mentioned earlier in the show that nurses at UNMH have been big winners of the Nursing Excellence Award, and you actually have a picture of 7 of your colleagues who have also taken home the award. Can you tell us who we're looking at here?
To the right is Kathy Kramer, myself, Valerie Boatwright, Zita Pitcher, Deborah Martinez, Linda Rogers, and Teresa Rael.
And so did they win awards in different categories, or is this just awards from different years?
In different years, but in the perioperative award. And then I believe Teresa Rael, a supervisor award.
The supervisor
Charge
award.
nurse, yeah. But everybody else was a perioperative nurse.
Well, great. Well, thank you. Well, congrats to all of them. Now, who are we looking at here?
To the right is Valerie Boatwright, one of my nominators, and then Linda Rogers is also a nominator. And she's nominated 6 of the different people that were on there. And then Kathy Kramer nominated Linda Rogers.
Well, we love having people like that taking care of us. It's so good to know, and of course we want to wish congratulations to all of our winners, and we want to thank you so much for coming on today, Connie.